Hello everyone, this is Shiraz Mumtaz. Today's topic is electrocardiogram correlation to the cardiac event. Okay, objective is what is ECG or EKG or what they say, and how does it correlate with the cardiac event? Okay, during the time of contraction. Okay, and what ECG changes occurs in the pericarditis? This is the scholarly article. Okay. So basically, ECG record the electrical activity that reaches the skin, okay, due to the electrical activity in the heart, okay. That does not actually record the electrical activity of the heart by itself, okay. Whatever is activity is reaching to the skin, okay. So ECG, the electrode that we have that utilizes the electrodes, and the lead is actually getting that difference between the two what is it called electrical difference between two electrodes, okay, for its positive pole, okay. So ECG deflect the upward, it's go upwards and in the form of wave, when there is a depolarization, okay. The ECG does not recording a membrane potential or an action potential, okay, to be precisely. All right. What are the standard the 12 ECG leads? We have six limb leads, 1, 2, 3, and AVR, AVL, and AVF. We can explain it in the next slide. And then the six chest lead that we have V1, 2, 3, 4, 5, and 6. Okay, and each ECG leads record the unique viewpoint. So we're gonna show you that what are the viewpoint does it show, some of them inferior and lateral or anterior. Okay. Okay. So now right here we have for example, this one is for the V1, and then this one for the V2, sorry, the ECG limb 1, 2, and 3, and then AVR, AVL, and AVF, okay, that's shown in the picture. So what is the ECG wave? They have we have the P wave, which is because of the atrial depolarization, the QRS complex, which is the ventricular depolarization. For the atrial repolarization, actually we cannot see because actually it happens at the time of QRS complex. So that atrial repolarization, it cannot be seen, okay, during the ECG. For the ventricular repolarization, we can see, which is the T wave, which will gonna come in subsequent slide later on. Okay. The ECG segment, we have the pair segment, which is the AV nodal delay, whenever, there's a traveling between the atrium to the ventricle. So between atrium and ventricle, there is a there's a kind of a station, okay, that there's a AV node delay that happens in the middle between atria and the ventricle. The ST segment elevation, that happens whenever there is a ventricles are completely depolarized, okay, and the contractile cells and the plateau, whenever we see the plateau, we're gonna come in subsequent slide. And then at the time of plateau, the blood is being rapidly ejected from the ventricles. The ST segment, elevation happens at the time of usually happen in the typical myocardial infarction, okay, and depression happen in some of the cardiac ischemia, which we're gonna be we're gonna explain it in the PR depression, or the diffuse ST segment elevation in the pericarditis. Okay. So PR interval, what happened, how long is it? Okay. So PR interval is usually 120 to 200 millisecond, okay, and the it's a prolonged PR interval, okay, which is more than 200 millisecond, which means there is a AV nodal delay, okay. So we just say that atrium and the ventricle, there is a AV node right here. So if there is a not enough is going from the atrium going towards the ventricle, is called a AV nodal delay. If it is more than 200, what is called millisecond. All right. There is a QT interval. The QT interval is showing the what do you call it, ventricular depolarization and repolarization. Okay. All right, so this is what I was talking about, what we're gonna talk. Okay, so right here, this is we were talking about the PR interval. Okay, and this is what they call a QT interval, like which is a atrial the ventricular depolarization and then repolarization. Okay, and then right here the PR interval, which means what they call the atrial depolarization, and whenever there's a PR interval is delayed, like it has more than 200 millisecond, then it is say like there is a AV nodal delay. Okay, and then as I said earlier, the P wave is for the atrial depolarization, the QRS is for the ventricular depolarization. Okay, but since the atrial repolarization happened within the development of the ventricular depolarization, so we cannot see because it maxed by the QRS complex. And right here, as you can see, there is a T wave. T wave is for the ventricular repolarization. Okay, so whenever there is a ventricular repolarization, that you can see, not the atrial repolarization. So in the next slide, we're gonna see how does it happen. So right here we were talking about the atria and the ventricle, and we can see the AV node right here. Okay, so AV node. So as you can see, there's a rising in the SA node, which is the sign of atrial node. Okay, and it begins at like the what they call the 50 to 100 action potential generation of the 50 to 100 action potential per minute at rest. Okay, and then as I said, like there is a reaching of the P wave is developing at the time of atrial depolarization. Okay, so a P wave is there. Okay, and right here, whenever we see the PR interval, so there is a what you call, it is reaching the AV node. Okay, and going towards what you call the AV bundle. So AV bundle between right and left, like between the between the right and the left ventricle. Okay, as we discussed it earlier, that if there is a what they call the PR, like more than 200 millisecond, which means that there is some delay is going from the atria going towards the ventricle. Okay, and right here there's a Q wave is developing. Q wave is going downwards and going QR and then S right here. So right here, as you can see, it is going towards a what do you call the left and right bundle. Okay, bundle branch, and then it is a beginning of the ventricular depolarization. Okay, and whenever you see the QRS the complete, you're gonna see a completion. It is the beginning of the ventricular depolarization, the Q wave. Okay, going below the the RS is going to be the completion of the ventricular depolarization. Okay, all right. So right here we were talking about the pericarditis. Okay, pericarditis is actually the inflammation of the membrane around the heart, which we're gonna show in the next slide. Okay, the thing what's happened is like the chest pain. It is the unusual chest pain. Usually, what happens, like that I learned from my professor, that if there is a chest pain while you are positional. Okay, when you are bending backward, okay, the chest pain increase. When you are leaning forward, the chest pain decrease, because what happens that whenever you see a backward, when you are bending backward, your pericardium is stretching, so you have more chest pain. When you are leaning forward, there is a stretch is release and there is a decrease in the pain. Okay, so that's what pericarditis is. Okay, to differentiate with the help of symptoms. Okay, the objective is like there's a brief the typical signs, so, usual treatment, and then we have the possible problem of pericarditis seen in the primary care. That happens like very commonly. Actually, it happened like one of my students had it, and I was able to diagnose her. But it's not very much of a troublesome, or not very what do you call life-threatening. All right, so this is what I was talking about. Like, this is normal pericardium lookalike, and this is the pericarditis lookalike, which, as you can see, the redness. So, which means the inflammation is going on, okay, and it is trying to heal itself with the help of what is it called, its own immune system, which is white blood cells that are attracting, and that is causing the painful symptoms. Okay. So now for the what changes that happens in the pericarditis, you're gonna see very rarely that that PR depression. If it happened right at the time of if the EKG is taken right at the time of pericarditis, that you're gonna see PR depression like this, and then there's a diffuse ST segment elevation, which means that like in diffuse actin segment elevation, you're going to see in many of the leads, you're going to see majority of the ST segments are elevated like this. Okay, so it can be up right here, so it has to be at the bottom, like you see right here. So this is the line of reference, so PR depression and then the ST segment elevation. This is a hallmark sign for the pericarditis. Okay, all right. All right, so now right here, the typical sign of the pericarditis, as I discussed earlier, there is a sharp pain that worsens with breathing. Okay, and there is a what is it called? Worsen with the breathing as well, but it can be what is it called? Falsely associated with, or is most commonly associated with the pleurisy, which means some of the lungs disease. Some of the lungs disease can cause this, but so don't what is it called? Correlate with the breathing, but as you can say, better with the leaning backwards, okay, and then rather gets bad or worse with the leaning backwards, and then better with the leaning forward. Friction rib, yes, that happens, okay, and you can hear it with the auscultation via the stethoscope, okay, that can happen. Friction rub, the because the thing is that the pericardium is rubbing against those those inflamed pericardium is rubbing against the heart, so that can happen too. Okay, so as I said showed earlier, the ECG might show the PR segment depression, and that's and broadly elevated ST segment elevation or diffused segment ST segment elevation, which is look curved upward as I showed earlier. What are the more common cause? Sometimes it is idiopathic, no known cause, okay, that can be identified, and sometimes it is viral. Like sometimes somebody have the viral, like coughing and all that. That can happen too. How they treat it? They treat it with giving the just the normal steroid anti-inflammatory drugs like the naproxen, indomethacin, okay, Aleve or Advil, that kind of medication, and colchicine. Colchicine is usually in a severe condition that can be mostly common is used for the gout pain. Okay, all right. The problem that can happen with the pericarditis, that can be the fluid backup, like the cardiac tamponade, okay, and then myopericarditis. Muscles can also be inflamed, okay, if it's not treated properly, okay. And echo, we're gonna see the effusion. Effusion means that there is a accumulation of fluid between the heart and then the pericardium. Constriction, okay, that can happen too. Restriction, or and then the tamponade. Tamponade it's dangerous. Okay, tamponade is dangerous because there is a fluid accumulation between the what is it called, the pericardium and then the heart, and that can cause a low blood pressure and then the swollen neck, and then you can see that distended veins. Okay, muted heart, or you can see the electrical attendance. Okay, that because there is no connection between the pericardium and the heart, and the heart cannot be heard properly. I mean, it is obviously beating, okay, heart, there's a heartbeat, but there is a fluid between the heart and then the pericardium, so we cannot hear it properly. And then there is a condition called a pulsus paradoxus. That's I was talking about. That pulsus paradoxus means that that sometimes when there is a what is it called, a heart is connected with the what is it called, the pericardium, you will gonna see the heart beating, otherwise you may not see it. Okay, and there may be a very mild what is it called, fever as well, because of its viral in origin. Okay, all right, and this is the reference that I use. Thank you very much.